So what I wanted to do initially is talk about the definitions. So quite a few people are aware of the term empathy distress, and this kind of indicates, suggests what it says on the tin really, and that is that we become distressed by the empathy that we show. Another term for it is compassion fatigue, but actually this is increasingly becoming an unused term, as our compassion for the people we work with doesn't fatigue. And certainly now what they're finding from a neuroscience point of view is that it's actually the empathy as opposed to the compassion that is reducing. So a definition of compassion fatigue, empathy distress, generally refers to this state that those of us who work with helping people or animals in distress experience, which can manifest as this extreme state of tension and distress, and potentially a preoccupation with the suffering of those that we're helping. And this can become so distressing that it can create what we'd refer to as a secondary traumatic stress for ourselves, for us in the role as the helpers. And unsurprisingly, this regular exposure to distress of other people, animals, anything that we connect to, has an impact on our own well-being. And you know why you're in the jobs you're in. Those of us who have come into caring roles tend to want to go into them because we are empathic individuals with a value base that includes wanting to help and be there for others. And when this exposure to distress is associated, is coupled with this sense of responsibility that so many of us have as part of our day-to-day job, really, for alleviating suffering, it can lead to this full-on empathy distress. And some of us, and it can be a highly effective strategy, might use emotional distance to manage. So, very much I mean by that, maintaining a professional boundary. And in the short term, it's a really beneficial strategy for managing the suffering we might experience when we have this exposure to distress coupled with this sense of responsibility. However, like most strategies that we tend to employ, it doesn't really offer a solution in the long term, because when we become depleted and we put in this detachment, these professional boundaries, we run a real risk of almost detaching from our own emotional responses. So, it's really difficult that if we have developed an unconscious mechanism that allows us to detach from the feelings that we are trying to avoid, then our emotional experiences across all our life circumstances, and not just at work, can become significantly impacted on. So it's not as if we can detach from the distress of others at work and then simply, when the home time comes, we can turn that emotional experience back on. And so the significant implications for this as a strategy are that we're going to reduce our experience of a whole host of emotional experiences, including joy, pleasure, and this empathy distress is likely to lead towards burnout in the long term. because, as I say, we can only employ this kind of detachment strategy for so long before it starts to invade all aspects of our life. So if we're experiencing high levels of empathy distress, eventually there's a very good chance that we're likely to experience burnout. And when we look at the specific definitions of burnout, it's this state of either or, you know, could be both physical and emotional exhaustion, and just this sense of overwhelm. And this occurs when you experience long-term related stress, or when you have worked in a very emotionally or physically draining role for an extended period. And so I imagine that is, you know, very, very relevant to the majority of us who are working in the NHS, in social services, and in all of those additional carer and professional roles outside of those bodies. And the actual impact of burnout can show up in many, many ways. So that might be this sense of exhaustion, feeling a big sense of self-doubt, not sure that you're doing things correctly, a sense of hopelessness, panic, anger, a lack of motivation, and a more global sense of the detachment that I spoke about, you know, very much this sense that almost not feeling as though things are real, perhaps. And, you know, it's the thing that makes us prone to empathy distress and burnout is that we work in the roles we do, and they're hugely rewarding, but what makes them rewarding also can make them challenging. So these public sector roles and any roles that involve caring for others are often embedded in these foundations, these values of meeting very high standards and avoiding harm. You know, it's why we turn up in the morning. And unfortunately, we're very aware that if we fail to meet some of these standards, that there are significant detrimental outcomes if things go wrong. And while we obviously want to meet these high standards, unfortunately, these foundations that are essential do encourage this sense of perfectionism and anxiety about our work and how we manage our work, and certainly an added sense of anxiety about whether we are failing or if there's any uncertainty in what we do. So unsurprisingly, us as staff can develop this really heightened sense of responsibility for our service users. And then should anything anything go wrong, then we experience doubts about our competence, and this anxiety continues to build. And if and when things do go wrong, because they do, because that's the nature of life, things can become even more challenging for us to continue to develop and maintain our professional confidence. And there are, again, a few strategies that we tend to use often unconsciously to manage this challenge to our confidence. And some individuals will use avoidance, and this could show up as avoiding tasks because we are just so fearful about getting them wrong. So it's very much like, yeah, I'm not going to do that. On the flip side of that, others choose to overcompensate, and this means that these individuals are likely to over prepare aspects of their work, seek reassurance, And you know, there are significant professional and personal implications for utilising either of those strategies. And you know, our sense of self and our value base is very much often enmeshed with our sense of achievement. And if we use either the strategy of avoidance or overcompensating, then there's a good chance it's going to result in feelings of inadequacy and eventually shame. And it becomes a bit of a vicious cycle then, because if we're continually anxious that we're inadequate, then we're going to be more fearful of getting things wrong if we're avoiding. So we're going to avoid even more. Or if we're overcompensating, we're going to over prepare even more. And this means that our chances of mistakes are going to go up, and this is further going to impact on our well-being. So, you know, as we can see here then, really, that we're already in a vulnerable position by choosing a career in which we care for others. So there is an acknowledgement that this is incredibly challenging and rewarding, and that over time, having this experience of distress can lead to us developing unhelpful strategies and eventually burning out. And then the strategies that we continue to try to employ to manage this further exacerbate all of that kind of experience. So it's really all interconnected. So it's something that, as I say, is very, very pertinent to the caring professions at present. And then what's adds to all of this is, despite experiencing burnout, so many of us have values that have led us into the roles we're in, and hence we're very likely to be trying to do our best, and we continue to carry on because we have that value base where we want to be doing our best. And being you know, a caring, empathic individual makes it extremely hard for us to push back when we are faced with unrealistic work demands and self-sacrifice, and putting others' needs above our own often seems like the only option. And a lot of the staff wellbeing literature at the moment identifies chronic work overload as one of the main contributors to staff stress and burnout. Yet it's really, really difficult for us to put some boundaries in there often, because the people that we're caring about or supporting may well be the individuals that suffer as a result of that. And so we go straight to, we'll put our own needs on hold. And you know, in terms of the caring professions that we're all in at the moment, the context has been absolutely paramount in really highlighting and exacerbating a lot of the shortfalls of the organisations that we can work for. You know, not to have a go at organisations, I just generally, you know, as a society. So, you know, there's been things like the pandemic, obviously, austerity, the cost of living crisis, currently a real issue, Brexit, a lot of staff perhaps who were supporting left the UK. And then on top of that, we have these repeated organisational changes and restructuring, and all of those exacerbate everything else that I've mentioned so far. So it's, you know, I suppose I'm really trying to encourage people to be able to acknowledge that burnout isn't as a result of some sort of personal flaw. I mean, I think it's a difficult label to acknowledge in ourselves sometimes, and it's just such a perfect storm over the last, you know, half a decade now that's created some of these experiences for us. So if you are starting to reflect about, you know, maybe I am burnt out, you know, I've been doing this job for 20 years, I'm absolutely exhausted all of the time. What do you need perhaps to be aware of to know if you are experiencing burnout? Firstly, recognizing that you're struggling is the most important first step. But understanding why you're feeling overwhelmed or exhausted or burnt out will also aid you to know how best to deal with that. And I mean, when in a recent survey, staff were asked to identify symptoms of burnout, 85% of UK adults correctly identified them, but 68% of individuals mistakenly identified symptoms of anxiety. So, you know, although we're aware of burnout, it can be much more difficult for us to own, I suppose. So some of these are, well, the common signs really of burnout. So feeling tired or drained most of the time, feeling helpless or trapped and or defeated, feeling very detached or alone in the world, developing or having a very cynical or negative outlook, self-doubt, is what I spoke about earlier, not feeling as though you're competent in your role, procrastinating and taking longer to get things done, and feeling overwhelmed. So, you know, I'm sure that there are a lot of us that recognise some of those symptoms. However, the good news is we can recover from burnout. But it again also worth highlighting that if we don't do anything about it, if we don't address the underlying issues that are causing it, then we are likely to experience additional harm in regards to our physical and mental well-being, and that's going to be impactful at work and at home in our personal life. And yet, despite all this knowledge and prevalence, burnout is still really often misunderstood. It's very stigmatized. You know, as I said previously, it can be experienced as, oh, is it about me? Is it about my lack of resilience? You know, and actually it's not those things. And it's incredibly costly to both employees' health and well-being, but it's very costly to employers as well. So employers really need to have a vested interest in supporting staff recover from burnout. So again, another study here highlights that 46% of UK workers feel more prone to extreme levels of stress compared to a year ago. Now that was from 2021. So again, it'd be really interesting to see how that compares with now. You know, in my experience of the people I talk to, I'm guessing that might be even higher now. But certainly only a small percentage of individuals felt they were less prone to extreme levels of stress. And it is it's worth noting as well that gender and age also play a role in the prevalence of burnout, with women and young people reporting feeling more prone to extreme stress and pressure at work. So in terms of what we might do to recover from burnout, so as I mentioned, the first step is definitely the acknowledgement that we're experiencing it. One of the things that I'm very strongly advocating, usually when I speak to anyone, is self-compassion, and the ability to cultivate compassion for ourselves has a really powerful benefit on our physical and mental well-being. And it's not a particularly easy thing to do. It requires regular practice, because so many of us tend to not self-care and not think of ourselves kindly when we're struggling with something. We tend to blame ourselves, blame our shortcomings. And so when I talk about self-compassion, one of the ways we can cultivate this is to start to talk to yourself, either internally or externally, as you would when someone really close comes to you and says, oh, I've done something terrible, I'm an awful person, this has gone wrong. And, you know, I'm really confident in saying that we would all be, don't be so hard on yourself, be kind to yourself, these things happen, you're human. And it really is about trying to build that personal narrative for ourselves and our self-talk, just being kind to ourselves. And mindful awareness is also very, very beneficial. So noticing how we're feeling, and this is a really good antidote to that detachment that I was speaking about earlier. If we continue to check in with how we're feeling, naming it, and allowing ourselves to experience our feelings, it's really, really hard to detach, because we're connecting with ourselves. Attending to our basic needs, as simplistic as this might sound, again, the demands of our working lives and then the context of everything that are occurring in our personal lives means that it's often really difficult to fit in a healthy, nutritious diet, enough exercise, enough sleep, having social connection with others, getting out in nature. But if you can, really prioritizing these basics, because they sit at the foundation of our health and well-being, and having a walk around the block, you know, is meeting a couple of those at least, and doesn't cost anything, and you know, hopefully is accessible to the majority of us. It's really difficult if we're feeling hopeless and as though we're to blame to ask for support. However, it is absolutely essential that we do, because again, this is what we would be encouraging those that we care about to do. And there will be someone that you can connect with and say, I can't do this anymore, I really need some support. I don't know what, you know, I'm asking for it. And this may be from colleagues, line managers, from the staff wellbeing hub, it could be from a GP, staff support services, friends, loved ones. You know, there will be something out there that you can connect to initially. There are numerous resources online, and I'm sure we either have them embedded in the presentation or they will be accompanying the presentation, that enable you to practice some of these self-compassion cultivation exercises. And it might be that you ask yourself for kindness and support. And then taking time out for you. If you are not well enough to be at work, you will need time to heal and take time out. And again, that's really, really difficult with these value bases that we tend to have. But if we don't and we burn out, we cannot deliver the support and the the professionalism that and the empathy and the caring that we want to deliver. And not only that, it's self-compassion is giving ourselves the same kindness and care we'd give a good friend. And there is so much research that suggests that if we improve our self-compassion, our compassion for others actually goes up and we are much more able to be compassionate. So really thinking about what kindness and care would we give to a good friend, giving yourself that same response when you're having a difficult time or failing or noticing something you don't like about yourself. And as I say, those are universal experiences. I've never met anyone to date who hasn't had a difficult time, failed at something, or doesn't like something about themselves. And Christian Neff is very renowned in the whole of the self-compassion movement and has got loads of free resources. And it's about, it's not self-compassionate to have a stiff upper lip mentality. It's asking, how can I comfort and care for myself in this moment by moment? And what makes it even more difficult, but very worth it, is that self-compassionate acts are often the things that we do that most of us would consider involve a degree of discomfort. So sticking to eating healthily, going to bed early when we feel we've just got back from work and we've done nothing and our lives are just about work, sitting and meditating, oh, how's that's really boring, quitting smoking, exercising. But these are the things that are likely to be the things that are improving our health and well-being, and hence these are the self-compassionate acts. And it's about, us wanting to do this because we're important, wanting to take the kind action rather than beat ourselves up. As beating ourselves up about something that we've done or something that we consider we're lacking is just much more likely to end in failure, and our mood will decrease, and then our self-compassion will decrease even further. And taking it a step further, this term fierce self-compassion again really highlights that the acting in the world to alleviate suffering and involves protection requires motivating ourselves. We need this fierce self-compassion, our ability to say no, that's not okay. I'd really like to help you out right now, however, that's out of work time, or I'm already committed. You don't have to have a battery of excuses. Your reason for saying no or drawing a boundary or fighting an injustice you experience is because it's what you need to be happy and well. And if we are stuck in a bad situation or we have habits that are harmful, it's about us choosing to do something different because we care about ourselves, and not because we're like, oh, I've got to do this because society values this body shape or this hair colour more than another. So, you know, it's difficult because it's not our fault. A lot of what we experience is as a result of everything that's going on around us. However, as adults, it is our responsibility. And if we can just start to chip away at putting these self-compassionate, this mindful awareness, these basic well-being strategies that we could all reel off, and I'm sure we all reel them off to lots of people that we work with, into action for ourselves, then we are making a big inroad to alleviating our experience of empathy distress, and hopefully you know, massively reducing our vulnerability to burnout. So here, these downloadable resources have got a whole host of questionnaires specifically around, are you burnt out? You know, there's lots of, on the Paula Redmond website, there are stress buckets, burnout toolkits, selfcompassionate.org, and the category exercises named will take you straight into free, short, guided self-compassion exercises. David Hamilton has written loads about kindfulness and kindness to ourselves and others. Mindfulness, there is an absolute you know, a load of information out there now on NHS websites and on Mind. And that's kind of a very whistle-stop tour, really, of this huge topic of empathy, distress and burnout.